Hello viewers and my dear student, this is Divya Pandey from RGCSK and I am here to welcome you all in today's live class. Today's live class is on a very important topic, that is adolescent gynecological problems. Before leading ahead with our live class, I would like to request everyone, please like, share and subscribe our YouTube channel rgcsk.edu. So here we'll start about the topic adolescent and gynecological problems. Like adolescent is an age, it is an transition phase from it is a transition phase, also we can call it as a teenage. From basically some of the books will have that 10 from 10 age to the 19, some of the book will have like 13, which is coming at the end, it is coming teen from 13 to 19. So this is like a transition because the body changes will be occur, especially in the female's body. So there will be many chances, like basically the hormonal changes will be at the peaks, and some gynecological related problems can be occur in the females. Basically in the girls, sometimes the girls are not aware about many things. Basically if we'll take as an example like menstrual hygiene, some of them like they will be very introvert, even the family won't be capable of telling them properly about the menstrual hygiene, using of sanitary napkin, discarding sanitary napkins. So many problems can be arise. So these all collectively, if that during the adolescent type, if they are not being treated, that can be leaded to the conditions like in while they will be become adult, they will conceive for the babies, they will have the problem while conceiving the babies. So again we'll study like at the end of this session what will be our learning objectives. At the end of this session, student will be capable of knowing basically what is a adolescent person. Who is adolescent person? Describe what are the common gynecological problems in an adolescent can be occurred. Explain, like they can basically they can explain causes, clinical feature, investigation and manage those things. Like some home remedies will be there, some like basic modifications can also be there, so we can protect ourselves. Basically for example, we can take example like a nutritional level, so taking proper a balanced diet. Next is discussing the role of what is the role of a nurse in helping out an adolescent girl and like giving counsel, giving education whenever they are coming, or like we are going for a school health programs, community posting. During those posting we can also educate the girls. Promote reproductive health education among the adolescent, means wherever we are going we should educate them. Next we'll see about what is the introduction of this gynecological problems. Adolescent is a transitional period, like from one section to the another section the body is getting changed, like some sexual organs, secondary organs development will be there, then the reproductive organs will be activated and going to be perform their activities, like the menarche will start. Those all changes will come in their structural changes will be there. For example, if we'll see in the boys, their voice changes will be there, beard will be there, the ingrown hairs will be there. So like that also in female there are the changes in the bodily changes which can be visible outside, and internal body changes also there, basically on their reproductive organs, because the body is going to get mature to get conceived or to have the babies. So it is a transition phase between childhood and adulthood. So between two it is a transitional phase. After adolescent there will be adulthood, ranging from the age 10 to 19 year of age according to the World Health Organization. This age is according to WHO in different, like if you will report the different book you will get the different range of age for adolescent. Then during this period, rapid physical, psychological, sexual and reproductive changes occur. Gynecological problem during adolescence require a special attention because they can affect the future reproductive health and overall well-being. So if, for example, if child is of 18-year age and she still didn't reach her menarche, she didn't started with her periods, so basically it's an parent's responsibility. We should educate the basically to the female child what are the body changes can be occur. So we can meet, or we can we should have the consultation with the gynecologist, or we can start with some medication. Sometimes the hormonal imbalance will be there in the children because of their environmental changes or the type of routine lifestyle, because of fooding pattern they do have. So these are problems are arising, and sometimes menarche is very early. Sometimes like you can see in the research and even in your surrounding, the girls are getting menarche like periods at the age of 8 and 9, even though these are not mentally capable of handling those all situations. Still these are the changes, and this all things are arising because of some hormonal changes, lifestyle, our surrounding and the way we are leading our lives. So it is all about adolescent problem, the transition phase. Next, we'll see what is the definition. Adolescent, the period of growth and development between 10 to 19 years. It is a time of change and preparation for the adulthood. So this is a phase from, basically we'll take from the 10 year to the 19 year. It is a time when body will get mature, organs are developed, but maturation and proper functioning will start. For example, pubertal development. There will be a like growth spots will be there, like body height and weight will increase. The specific area weight enhances will be there. Body hair growth will be there, specifically in armpit hairs will be there, then in groin hairs will be there, then perineal area hairs will be grown, and the body changes. There will be a difference between a girl body and a boy body, so these changes will be there. For example, if we'll take in a boys, the voice changes will be there, the hoarseness of voice will be there. Then in female, the body stature will be changed, the more weight will be over the buttocks area, in a boys more weight and the broadness will be at the shoulder areas. So these are the physical changes. Maturation occur, their height will enhance, their weight will increase, development of the sexual characteristics will be developed, and menarche and reproductive maturity will be there. In girls, the first menstrual periods will start, that is known as menarche. Emotional and social changes like mood swings will be there, increased sensitivity, like if you will tell them anything, they will take it into their heart, they will be angry, they will have the tantrum so much during, like they won't listen to their parents. This is the only group, they will feel like their peers are, whatever their friends are telling, it is correct, what parents are telling, this is wrong. So they will have so much of anger, they want like personal time, alone time, they want free time with their friends. So these are the changes which is coming by the age. More sensitivity will be there, then like there will be a peer relationship, a relationship with the like different or genders will be there. So these all things will be happen in this age. Then development of sexual identity. Adolescents explore their sexual feeling, orientation and gender identification, forming their sense of self and personal values. The sense will be developed and their personal perspectives about the other gender will be developed, their concern, their like interactions will be enhanced. So this is a phase, there will be a so much of growth and development, and the bodily changes will be there in a child. Next, we'll see what are the adolescent gynecological problem. Basically, commonly what can be happen, like first of all, there is a menstrual disorder. Menstrual disorders have plenty of things. Sometimes the woman is getting like female or girl is getting so long menses, sometimes very less days of menses, sometimes like within each 10 days they are getting the menses, sometimes not getting the menses. So these are the problem. Dysmenorrhea is basically a painful menstruation while you have the periods, that time you are having the severe pain. Next is about abnormal uterine bleeding. There will be unknown origin of bleeding, so that will be a vaginal bleeding. And amenorrhea. Amenorrhea is basically you reach the age of puberty, but still you didn't started with your periods, you didn't reach with the menarche. Then polycystic ovary syndrome, that is basically on the hormonal changes. When it will be normal, it will be subside by their own, but if the proper things are not taken, it may be their sizes can be increased. Then vaginal discharge and infection. Sometimes reproductive tract infections will be there. Sometimes like at present time, if you will see na, many things are there, like you are using the vaginal wash and these all things, sometimes they are going to affect, they will like alter the normal pH values of your vaginal secretion, which are going to protect our perineal areas. So that can also lead to the infection. And the type of innerwears we are using, how we are keeping them dry outside. So some basically we are drying inside the rooms, so where the moisture will be there, the bacteria will develop. So these can be the reason for infection and other, like if the infection of vagina is there, if it is not treated well, if or a female is not getting concerned about that or not consulted to the doctor, not taking medicine, it can be radiated to the other reproductive organs, like it can reach to the cervix, cervicitis can be there, then endometriosis can be happen. Next is teenage pregnancy. At present time, you can see like basically if you'll go, the people are running behind the cinema. So we are watching out the cinema reels. We are thinking like a teenage, where whoever the children are in their teenage, they are thinking cinema is everything. How the life is shown in the cinema, we should have the life like that. So it cannot be practically possible to have a life like this. So basically sometimes they won't have the sexual education. That's why our government is also adding in our curriculum, in like 10th 12th curriculum, sex education for the children. There will be a specific classes for them on that. Then sexually transmitted infection, just because having the multiple partners or having the sexual intercourse without any type of protections, that can lead to the STIs, and ovarian cysts can be happen, and the other congenital anomalies of reproductive tract can be there. So these are the some common problem which we are going to discuss in an like in a detailed way. So here we'll see one by one. Like first is menstrual disorder. Menstrual disorders, many are there, like we've seen dysmenorrhea, menorrhagia. Menorrhagia is basically heavy or prolonged bleeding. Like basically it will be at 7 days. If maximum it is of 7 days, minimum of it is 4 to 5 days of cycle. Periods days will be there. But when a girl is like extending more than 15 days, 10 days, and it is heavy bleeding, how you have to assess, like the how many sanitary napkins are being used in a day and how much area of the sanitary napkin is being filled by your blood. So this is known as menorrhagia. Next is oligomenorrhea. Oligo means it is infrequent but less quantity or less periods they will go. Basically, like in a 12 month of time, you need to get a 12 time periods. Some girls were getting like 8, sometime 2 months are getting gap. After 3rd month they are getting, so 9 or 10 periods they are getting in a year. So that is known as oligomenorrhea. Then amenorrhea is like totally absence of periods, and polymenorrhea means like having a more number of periods. Many times, like after 13 or 15 or 20 days, again periods are being started. Then premenstrual syndrome, like PMS is like having some mood swings, or before a week, before 3 days, 4 days, a woman will get some sign and symptom, like pelvic pain will be there, back pain will be there, spinal pain, mood swings, headache, vomiting, and nauseated feeling will be there. So these are signs can be happen. Then premenstrual dysphoric disorders, PMDD, this is like a severe form of PMS. Severe form, like they will have so much of irritation, then like depression, anxiety, they want to be alone, difficulty in daily activities, they cannot even walk properly, they cannot do their routine works properly. Next we will see that is abnormal uterine bleeding, that we'll discuss afterwards. So these are all about the menstrual disorders. We'll see about some management and prevention of these disorders. Like if we'll, in a simple form, if we'll say any irregularity in the menstrual cycle, it could be in duration, it could be in an amount of bleeding, that is all called as menstrual disorders. Next, what we discussed, like menorrhagia, oligomenorrhea, these are all the type, like irregular menstruation, heavy menstrual bleeding, scanty menstruation, it will be a dark color menstrual discharge will be there. Then frequent menstruations can be there. So these are all the types of menstrual disorders. What can be the causes? Like immature hypothalamic pituitary ovarian axis, means this is a phase, even the girls is having the periods, they are having immaturity in their body. The reproductive organs are getting mature, getting more growth and development is there. So there will be hormonal imbalance can be there. The pituitary gland won't be capable of giving properly hormone secretions, progesterones and those all things, like estrogens won't be secreted properly, and they won't be capable of maintaining the cycles properly. Then hormonal imbalance, same thing is there. Then stress, nutritional. Then stress, like children will have stress, like their body shape and size, they want to maintain this, they want to wear those kind of dress, they are wearing like these dresses are there, for that I need to be fit in this, so they will be sacrificed or they will skip their meals. So sometimes this can also be caused the menstrual disorders. What are the management? Basically the counseling is the first most thing. Some of the girls won't be aware what is menstruation, so before, like a 10-year 8-year girls can be educated or counseled for those all things. If the parents are capable of, they can, or any healthcare facilities if nearby there, OPDs we can go and have consult to the gynecologist. Iron supplements, like it is an WHO role to provide those who are menstruation or those in a age of menstruation, pubertal age, we should provide iron supplements for them. Then balanced diet, properly full 3 meals has to be taken, and if required, if it is not manageable by these all things, then hormonal therapy will be required. Next is dysmenorrhea, that is painful menstruation occurring before or during the menstruation, like before getting periods, during periods, or after getting periods, some abdominal cramp, thigh pains will be there. So every individual experience different type of menstrual pain. Every woman won't have the same type. Sometimes some women will have the mood swings more, some women have the vomiting during this time, some women have some smell allergies. These all things, some meditation, some anxiety, some having the panic attacks on duration, and some having peak level of pain, some having less level of pain. So this can be happen. So two types of dysmenorrhea is there, primary and secondary. In primary, no pelvic pathology, like no any other conditions are related with the pain, only because of periods the woman is having the pain. Secondary dysmenorrhea is about like some other disease condition or pelvic conditions are there. Because of that, during periods the woman is having pain. So this is secondary dysmenorrhea, but it is very less common. Because of periods only the woman will have the pain. Next, we'll see what will be the symptom, like lower abdominal pain, backache, nausea, fatigue, and management, like hot fomentation, like hot water bag. We all know that compressions we can give, exercises, some breathing exercises we can teach, and there's like some medications are there, like these are the sedations or pain relievers we can give to the, if at the end if things are not working. Otherwise, some home remedies are there. We can have lukewarm water, we can have a hot food, like basically the rice and dal, full stomach we have to eat, and like we have to do basic proper hot water sour we need to take. These all things we can have. And hormonal contraceptives when prescribed, if doctor is prescribing anything, basically we need to bear down those all pains, just take rest, proper sleep, food, and relaxation. Take some relaxation activities like watching movies, going out, relaxing, having stories. Those all things can divert your mind from the pain. Next, what we'll see, it is a next condition about abnormal uterine bleeding. Uterine bleeding from the uterus, from the any layers. Basically, it will be from endometrium, myometrium, or perimetrium. It will have bleeding, but of unknown origin, from why it is being occurring in the woman. So we'll see definition: bleeding that differs in frequency, duration, and amount from the normal menstruation. And if we'll see that bleeding, that color of blood and consistency of blood will be totally different from the menstrual blood, and their duration, their quantity, their quality will be totally different from what basically menstrual blood is. So causes can be involuntary cycles, hormonal imbalance, coagulation disorders. Sometimes we are having a confusion among that the woman is having periods, or woman is having any coagulation disorder. Sometimes internal injuries will be there, and bleeding is from that specific part, and like clotting is not there, just because the patient is having some coagulation disorders. So we are thinking that I am having periods for a long duration of time. Even we are like escaping from going to the consultant for the gynecologist or doctor. So this could also be a reason. Then endocrine reasons, some hormonal imbalance, and our glands, how they are getting secreted hormones, how they are balancing in our body. This can be the reason for abnormal uterine bleeding. Symptoms will be like excessive bleeding, prolonged bleeding, and anemia. So if excessive bleeding and it is for long duration of time, it can lead to the anemia. Like patient will have deficiency of blood in the body, and anemia will lead to the like breathing difficulty, because if blood is less, then oxygen level will automatically low in the body. So patient will have fatigue, then breathlessness. These symptoms can be arise in the person. So first of all, management is HB assessment, like we need to have a blood test of a person. Iron therapy has to be given, hormonal treatment, blood transfusion if the severe cases are there, like if the more blood losses are there, and in a patient in a severe anemia, for correcting that blood loss, we need to give the blood transfusion. Other things we'll see after that, like amenorrhea. Amenorrhea, I already told about it. It is absence of menstrual period, absence of menstruation, like the girl would not have periods even though she is in her reproductive age or reached to her pubertal age. So there are two types of amenorrhea. First is primary amenorrhea, no menstruation by the age of 15 years, means a girl never got menstrual cycle. That is known as primary amenorrhea. And if we'll see about the secondary amenorrhea, it is absence of menstruation for 3-6 months after the menarche. For like once she started with the periods by the age of 15 or 16, then like 7-8 months she was having periods. Now for 6 months she skipped the periods. 3 months or 4 months she did not have periods. So this condition is known as secondary amenorrhea. Next we'll see the sign and symptom, like causes. pregnancy, it could be a pregnancy like unknown, it could be a teenage pregnancy, sometime the rape victims will be there, sometime the like present generation you can see like going out so much, having so much of clubbing and partying and those all things, even the like they are getting the drinks and everything are like easily they can see, so they will sometime intoxicated, they are there, they won't be aware what the things are being happened. So that could be the reason for pregnancy and they are not aware about. Then PCOS, polycystic ovary syndromes can be there. Because of that hormonal changes are there and they are not getting the periods. And thyroid, if like thyroid disorders like high thyroid or low thyroid is there, then that time hyperthyroidism or hypothyroidism is there, that also lead to the hormonal imbalance, and that can also be reason for the amenorrhea. Stress, malnutrition, if you are working under so much of a stressful condition, if you are unnecessary also taking so much of stress for like basic and small things, that can also lead to the amenorrhea or can be chances or can be indirectly or directly be the reason. And then malnutrition is like a main reason for getting this amenorrhea. Management, identify cause, hormonal evaluation, nutritional support and appropriate treatment, like all the aspect, history collection, those all things has to be mandatory done for a girl, and the proper treatment, appropriate management has to be provided to a girl or a woman. Next, we'll see about the polycystic ovary syndrome. What is a polycystic ovary syndrome? Poly, here the word from itself, it is clear that poly means many. A hormonal disorder characterized by irregular periods and excess androgen production. Means the woman will have the irregularity in periods in every month. Sometimes she will get in 15 days, sometimes it will take 2-month gap. So there will be irregularity. Sometimes she will get prolonged for 7 days, sometimes she will get only for 2 days. So what are the risk factors? Like if a person or a girl is having obesity or having a family history of this condition, insulin resistant, these are the some risk factor. Women can have a polycystic ovary syndrome. Then clinical features will be irregular menstruation, acne over the face, basically excess facial hair will be present, and weight gain can be there in an excess form. Investigation, ultrasonography can be done, hormonal profile test can be done, blood glucose testing also can be performed. Like it will have the 3-month back, the GRBS level can be assessed, so it can be seen if the person is having resistant to the insulin or those all things we need to assess. Then management is lifestyle modification, like waking up pattern, sleeping pattern, and the type of food they are consuming. Then exercises, hormonal therapies, yoga, meditation, these are the important things which can do the life modification and which can clear out those all things. Next is vaginal discharge and infection. Vaginal discharge and infection, we'll see about like for basically poor hygiene, fungal infection and bacterial infection. STI like sexually tract infection symptoms could be like vaginal discharge, itching, foul smell, irritation, and like the discharge will be in a more excess form. Management are like maintain genital hygiene, appropriate medication, health education. Genital hygiene is basically when you are having menstrual cycle, properly changing of sanitary napkins, because that is a waste product from the body which is coming out, and when it will come to the contact with the environment, it will automatically form the microbes. So if continue you are keeping that same sanitary napkin, it will lead to the infection to your vaginal area or other reproductive organs. So we need to have a proper routine for changing the sanitary napkin. Then perineal wash has to be, it can be done from the plain running water without any soap or anything. And if you wanted to use also the mild category which should not have so much of chemicals in that can be utilized. Then proper like fluid taking, like water has to be taken in a proper amount. Then basically the cotton innerwears has to be worn by a girl. And those cotton innerwears, after washing it out, it need to be dried under sunlight, because as we know the sunlight is a natural type of sterilization method. Then health education to each girl, how to maintain hygiene, how to discard the napkins, how to eat properly, how to like those all things. But if you are traveling, you are in a home, you are in a college, you are in a school, wherever you are, how to handle those situations. Next condition we'll see about the teenage pregnancy. Teenage is basically about from 10 or from we'll take about under 20% or a girl is getting pregnancy. Risk is mother anemia, well, because basically the girl is getting menses, but that doesn't mean their body is ready to adopt a child or make a child or for give a space to a child. Even they are having maturation throughout after 20 or 23. That's why our government is giving the age for marriage is about 24 years of age. So because till that much time is needed for a girl or an internal reproductive organs to get mature to conceive a baby. So there will be a highly chances of getting anemia. Preeclampsia, like the hypertension chances can be there. Patient can be in a like seizures can be there while delivering the baby. Then obstructed labor, because the muscles won't be that much elastic, and there will be a chances of getting stuck in a baby while having a normal vaginal delivery. Next, we'll see like risk to the baby. Prematurity, like baby can be preterm. As normally the 9 months, 7 days are there for the delivery, baby can be delivered in 6 months, 7 months, by 8th month. So prematurity will be there. Neonatal complication like congenital anomalies can be developed in a baby if they are getting prematurity. Prevention like sex education has to be given if colleges are initiated, but that is also parents responsibility to educate, whether you are educated or not. That basic education is sex education that you have to give to your children. Then counseling, then family support, where whatever your children is, you need to be back of your child, like you should support them basically. Next we'll see about the sexually transmitted infection, STIs. Commonly STIs are chlamydia, gonorrhea, syphilis, HIV, AIDS. Symptoms like vaginal discharge, pelvic pain, genital ulcer, burning mensurations. So if these are symptoms are happening, do not ignore those symptoms. If you want to go personally and consult to your gynecologist, even though this time the social media, you can search many things like basic symptoms, what color of discharge is coming, those all things, basic knowledge we can take, like home remedies we can take. And if you're thinking like it is not getting recovered, we can also get consult with the doctors. Safe sexual practice, like the protection has to be used or any contraceptive methods has to be utilized for this. Awareness properly and early diagnosis and treatment, like whenever you are getting any symptoms, don't take over the counter medication. Like if I'm getting fever, I'll take paracetamol, that will be subside. So paracetamol you will take, it will subside, but the thing which is happening inside, it won't be subside, it will be just suppressed for a time being. Again it will come more powerfully, so it will be more in a severe form. Okay, so next condition we'll see about the ovarian cyst. Definition: fluid-filled sac present in the ovaries. Means sometimes it is a normal thing, because basically I want to discuss on that. When ovaries are having ovums, ovums are inside the Graafian follicles, and inside that only they will get mature. After getting maturation, they will get released, and that process is known as ovulation. After that, that Graafian follicle will be left behind. So the basically process is there, they will be shrink and they will be subside in that. But sometimes that cavity are that sacs will be filled with the fluid. So those are known as ovarian cysts. And if it is less than 10 mm, 5 mm, it is a normal. It can be with the hormonally, it can be subside. But when the size is increasing and numbers are increasing, it is called as problem and ovarian cyst, and it will have the sign and symptom like pelvic pain. You will have irregular pelvic pain, irregular menstruation cycle, and abdominal swellings will be there if you palpate the abdominal area or lower abdominal area of the girl. What could be the management? Like observation, ultrasonography can be done, and if needed, it is rare to get surgery. Sometimes the hormonal assessments will be there, then alteration therapies will be there, so that can be a subside, or some medications we will give to get melted. So next condition is congenital reproductive tract anomalies. What is congenital? Congenital is basically which is by birth. A child or a girl is born with those anomalies. Here we can see a normal anatomy of a internal reproductive organ of a human female, and then we can see the Mullerian duct anomalies of uterine fusion. Means basically hamara if we'll see a uterus, it will womb, in other words we can call it as womb. It is like a pouch, it will have a space, it is having 3 layers, and it will give a space to baby to grow. And when their Mullerian duct anomalies will be there, sometime there will be a uterine didelphys, like two uterus will be present, sometime biconduate uterus will be there, sometimes septated uterus will be there, like septum is present in between the uterus. So that will be leading to the anomalies. When the child will have periods, they will have irregularities. When the woman is going to conceive, that time in conceiving there will be a problem. So that can also be as an adolescent gynecological problem. Sometimes vaginal and hymenal anomalies will be there, like the hymen, this thin layer is there, in that also anomalies can be there. Sometimes there won't be any opening will be there, vaginal opening won't be present, vaginal atresia means absence of vagina will be there. And sometimes like if we'll have the home deliveries, basically there won't be any examination of baby. Sometimes babies of like 18 years, 16 years, she is not having menstruation because she is not having vaginal opening, vaginal atresia is there. So basically the consultation is very needed for even a boy child or a girl child. For both the consultation is very needed. Then we'll see like example, imperforated hymen. There won't be any holes in the hymen, so there will be a difficulty in releasing of a menstrual blood. Then Mullerian anomalies, like that we discuss about the structural anomalies. And then vaginal septum, like the vagina is also separated into two, there will be a wall or a septum present. Symptom could be like primary amenorrhea, cyclic abdominal pain, difficulty with the menstruation. So these are symptoms a mother or a woman or a girl can facing while if those all things will be there. Management could be a surgical corrective counseling, correction can be there. Then counseling sessions also we can be conducted for a girl or a woman. Next thing, like, so till now we had been discussed like 8 to 10 basic or a common gynecological problems in adolescents. So what is a common nursing management? First of thing is assessment, daily history collection, detailed history collection, menstrual history, menstrual history. Basically it will have when you got the menses and how many days you are having cycle. It will be of 35 days, sometime it will be of 27 days, sometime it will be of 28 days, 30 days. So what cycle do you have, how many days of periods you are getting, what quantity of blood you are getting, discharge you are getting. Then physical examination, the development of primary and secondary reproductive organs, psychological assessment, nursing intervention, provide privacy and confidentiality, like do not share the personal things to anybody else, even to the healthcare professional, until and unless it is not directly or indirectly involved for the treatment or management of that client or patient. Health education to the child or a woman and to the family has to be given. Nutritional counseling, diet chart has to be made for a specific condition. Emotional support from the healthcare professionals and from the family has to be given. Medication administration if needed, and if the severe cases are there, the referral when required to the higher centers. What health education we have to give to the adolescent? Like menstrual hygiene practices, using of sanitary napkins, discarding it properly, those things we had been discussing in the previous slides. Then balanced nutrition, a balanced diet, a 3-meal full diet, properly physical activities like the exercise, yogas. The body has to be flexible, active, and immunity need to be built up. So that's why we should have a good quantity and good quality of a food. Personal hygiene, environmental hygiene, prevention of sexually transmitted infection. So there should be a proper sex education, there should be a proper protection, and importance of regular health checkups. It doesn't mean we basically we think when we'll get sick we'll go for assessments or we'll go to hospital whenever we are getting sick or getting more sick. But you should have at least in a year 1 examination, health checkup. You can go to any health center like CSCs and PSC free of cost. You can get the, or district hospitals you can go to free of cost. You can get the health checkups. Mental health awareness, like counseling has to be there. Then sometimes there will be, if we are not giving proper education to the children, sometimes they will feel shy to share even with the parents. So these education has to be given to the adolescent generation or group of the society. What preventions can be there so we can prevent those all adolescent gynecological problems? Healthy lifestyle, proper nutrition, menstrual hygiene, vaccination, reproductive health education, and early medication and consultation. Next, conclusion about this topic. Adolescent gynecological problems are common and can significantly affect the physical, mental, emotional, and reproductive health. Early identification, appropriate management, counseling, and health education are essential to ensure healthy growth and future reproductive well-being. If like we are not concerning now at present in an adolescent person or a girl, it will lead to the problem in future while conceiving. While they will have the marriage, they will have planning for the kids, they will facing too much of problem. Even like basically if you see in a present time, pregnancy is a natural process, but at a present time it become a disease condition. Like from the time you are getting conceived, you need to go how many times to the doctor, how much medications you need to take. Sometimes you need to be on the bed rest, so that can also be a reason you won't have the proper normal vaginal delivery. So this is properly, like it will be starting from the birth. From basically you need to follow the healthy lifestyle. So it was all about my today's live class. So we had been discussed about adolescent gynecological problem. We had been discussed about dysmenorrhea, menstrual disorders, amenorrhea, vaginal bleeding, congenital anomalies. Many things we has been discussed. So I hope this session was useful for you. Please share with your friends and those who are from belongs to the nursing paramedical fields. It will be going to be very useful for them, as it belongs to the very interesting subject, that is obs and gynecological nursing. So thank you and have a good day. Please like, subscribe our YouTube channel rgcsk.edu. Thank you. Goodbye.